Nope, we don't.
30 seconds, anybody needs anything, I'll get started right on. Three 30, I will call this meeting of the Parkview Health Center Committee to order. To item 2, approval of the April 20th minutes. I make that motion.
Review 2023, the Parkview committee minutes.
Okay. Any comments, changes?
I didn't see anybody that, I didn't see any, but there could be some.
Hearing none, all in favor say aye.
Aye.
All opposed say nay. Carries. We're at item 3, public input. Here, everybody join our Zoom.
No.
All right, we'll close that section and go to item 4, the financial report.
So for the April financials, percentage obtained should be around 33%. If you look through our revenues on the first page, totals at the bottom, we're sitting at 31.78 budget, so we're down a little bit from our budgeted amount, but we're still pretty good for the the budget was prepared with a 140 census, and we're right around 100, and we're still doing pretty well compared to where we should be. Total labor, we're at 24%, so down from what we were last year, and well ahead of our budget for that. Travel is another one. We'll have a little bit more hit in this next month because a lot of the conventions and stuff were early May, so we'll be hitting more of those and coming up in the next couple months. Capital improvements, we're still sitting at only 7,000 spent there. Dishwasher and the water heater are still in the process of being done, so nothing is hit on that. Going through the total other operating on the end, bottom of the middle of the fourth page, we're at 26% there, so we're doing ahead of where we should be. You can see towards like 2/3 of the way down on that last page, we have the big transfer out. That's the ARPA money going back out of the fund. 8,681,000 or 681,000. So that kind of is going to throw our financials off at the bottom for the rest of the year. But if we take that money out of the budget number and the actual number, we're actually sitting about 1,300,000 better than what we had budgeted to use so far at this point of the year. So we're doing pretty well. Okay. And I know you had asked about the equipment repairs account. Last time 54,029 on the bottom, middle, towards the bottom of the first, third page. And there's, a big charge in there for our, no, that's for the Relias, or not the, yeah, I think the Relias gets charged into that account because it's an continual upgrade every year, so that amount gets charged there. I think next year, I think I'm gonna move that budgeted amount out of there into, it's more, to me, it's more like a subscription than an actual repair, so I think I'm gonna put it into there, so it just makes more sense.
I would agree with that. So Relias is used for our continuing education,
Sure.
to meet the requirements that the CNAs and nurses have to meet annually. RELIAS. Relias Learning.
No, actually, it's not, it's not Relias, it is the American Data. Which is our ECS, but it's the same thing, it's more of a subscription for that program instead of. And upgrades for that. And the training, the software.
It's a
Yeah,
software, yeah.
it's a software kind of subscription upgrade, maintenance type.
And that's,
Charge.
that's under the
Equipment repairs, yeah. That's where it had been budgeted in previous years, so.
And ECS is the software system that we use for all of our electronic medical records for all of the residents.
So Doug, the 1,329,864, what would you attribute the increased performance to that caused us to be doing better than?
Well, the revenue is higher, on page one.
Medicaid increase.
Medicaid increase is a part of that, and then also the non-operating grant revenue, the 48,102 line. You can see we're at
Yeah.
58% already.
Okay.
They gave us a big chunk of money this year over what we had thought that they were gonna give us. So
Grant money.
it's like a general grant. Not a specific, it's not specifically to anything. They just do a calculation based on our cost report. And that's the amount that they give us.
That comes
We
from
could
the
use it.
state.
That comes from the state, yes,
And then you can use it
or anything.
whichever.
Yeah.
That's what I thought.
Cover,
Yeah.
to cover losses or whatever.
However we want.
Whatever you want.
That's why there was such an argument at the beginning of the designated of the ARPA fund.
Thought that might
We
be
weren't
back.
sure if it was gonna,
After he was getting ready to file
Right,
at the end of the.
yeah.
Yeah.
Okay,
so.
thanks.
Does that mean you expect that line to actually come in greater than
Oh, yeah.
100% at the end of the
Oh,
year?
yeah, it'll be,
Okay.
yeah,
So great.
it should be close to 3 million.
And we don't make money. And the rumor is we don't make any money.
That's a real.
Yeah, it'll be close to a break-even year.
Yeah, hopefully.
Mhm.
Okay. Any other questions about the financial report?
Look at everybody. Yeah, you're doing this fine.
Thank you.
For the administrators report.
Okay, so I've got a couple pages for you here. One is the census report for April. So our average monthly census this month was 96. So our average occupancy rate was 57. That's pretty much right in line with Brewster Village from Outagamie County, from what I hear as well. We had 5 admissions from the hospital. We had 3 discharges. One went home, one went to a different nursing home because her spouse was there. And then we also had 1 expire in-house. Passed away.
So you say it's the same as Brewster Village,
similar.
the percentage occupancy, do they have wings shut down there too then,
Mhm,
just like us?
they do,
So is this common throughout the state?
It
right
is.
now?
yes, very
Okay, that's
common.
good to know too.
Yeah.
I wasn't aware of that.
It's very common.
Okay.
Mhm, yeah. The building that I came from, we had wings closed down as well too.
Well, do you know the average occupancy statewide? It's gonna be
I
like this?
Don't know off the top of my head.
Okay. You think we're
I
high
can
on-
get that number, or I can try to get that number.
This could be interesting.
Says he came on,
Yep. It is.
the guy that came in after you was my brother-in-law.
The person that came in after me?
Yeah. So,
Was it Art? Art?
our,
Yes. Yeah.
brother-in-law.
Oh, okay, nice guy.
Does
Small
River have a
world.
similar capacity as we do?
They have a larger capacity than us,
And but they're at the same percentage.
correct.
That's good to know too.
Yeah. So we currently have 32 on the waiting list. So we are pretty much right in line from the first quarter, sitting right about that 97 to 100 mark as far as census goes, fluctuating with short-term rehabs that we're bringing in. So private pay percentage for the month was hovering right at 19%. Medical assistance or Medicaid was at 69%. Family care, which is a managed Medicaid company, is 5%. Medicare Advantage or insurance is 5%, and Medicare was sitting at 1%.
What would it take for us to get that waiting list to zero? We have to open all the rest of what we have.
We would want to open at least 2 wings, I would say.
And the reason why we don't do that is primarily because we don't have to work.
Correct, yep, 100% reason why. Mhm. Yeah. And I would say 2 wings because most of these, the 32 on the wait list, these are long-term residents.
Right.
Yeah. Any questions on that? Or otherwise I'll go on to staffing. No, okay. So our turnover rate for April was 2%, 3 resignations. Current, and we had 6 new hires, so that's good too. Current open positions for RNs and LPNs is 15, CNAs is about 52, hospitality aides is 12, 0 housekeeping, so kudos to Doug and his team. No openings in his department. And food service, we're looking for about 3 people there. And just so you all know, these numbers are full-time equivalents. So as we hire a 50% person, it brings it down, but it's not gonna bring it down a full a full-time equivalent. So all in all, throughout the year, our turnover rate has been pretty stable, right about 3 to 2%, which I think is really good for any company or business. You probably saw on Fox 11, maybe you didn't. And also the Oshkosh Herald, we had a ribbon cutting May 10th at the training center. So just a quick little update on that. We had that paid feeding assistant program we were approved by. We've trained 17 new paid feeding assistants to help residents on the unit so they can help assist with meal service. Actually feeding the residents, you have to be certified in order to do that. We've had 8 students go through the CNA program so far this year, all 100% pass rate. We've got 3 classes coming up for that training center, 1 in May, 1 in June, and 1 in July. Those are filling up pretty fast too, so very exciting. I think we've got at least 4 in each class.
One was close to that. One was at least 6, and then the other ones are 4 right now.
Okay, and we can have a max of 8 students in those classes.
So this training center investment is paying off for itself.
100%. Mhm.
Yeah, and just in early May, we've had, I know we've added, I think, close to 10 new hires, between either CNAs or hospitality aides already, just in May.
You know, that's gonna boost your retention. You know that,
Mhm.
that's great.
I'd like to ask, how are you recruiting these people? Are they just coming by? Is it through the county? Is it through word of mouth? Is there a better recruitment possible? I mean, for kids getting out of high school, I know most of them don't want to work. Seems unfathomable nowadays, the work shortage.
Sure.
So is there some special recruitment you're using or?
Not that I know
They're
of,
going-
word of
well,
mouth.
And they have been going to the high schools. Both Megan and Sarah have been
Yeah.
going to the different high schools around the area and talking about the program. So that's, we're getting a few with
Yeah.
hospitality aides coming to start out.
And then
Start
their
the
friends are coming in, like I know my nephew, he's a CNA, he's brought a couple of his friends over. His coworker I work with, she's having her daughter go through it, and some of these people that are coming through, they have family members that work at Parkview, they've known someone that worked at Parkview, so.
You're not getting anybody from other nursing homes that.
That's not true, we are getting some, yes.
But not enough.
Not enough, no. But we are getting some, yes. Mhm.
When people get that feeding certifications, does that in turn increase the revenue?
No,
No, okay,
no. It does increase the quality of care.
yeah.
Mhm, yes.
So are we
Yes.
specifically talking about hospitality aides being trained to feed people, or are we talking about someone on the outside?
We haven't had anybody from the outside. Majority, it's gonna be hospitality aides. We've done social workers, we've done the therapeutic wellness staff, have been trained as well too. And then if
So
there's
can
any
re-
other
can
person,
relatives feed relatives, or if they talk to you, can a relative come and feed a relative, or is that a frowned on?
we really prefer that not to happen. It's a
Okay, just
paid
asking.
feeding assistant, so they have to be paid. So they have to be an employee of Winnebago County to do it.
Gotcha. Okay, okay.
Any other questions on the administrative support?
But you do bring up a very good point there for volunteers to maybe do that, so. I'm gonna reach out to someone I know over at St. Paul Elder Services. Prior to me coming into healthcare, I used to be a volunteer there through the Spoons program. And I was a volunteer and I could go in and I could help residents eat.
Okay,
So I will look into that.
I just wanted to know what the process was, because
No, you bring up a very good point though.
you answered my question. Thank you for looking into it.
Mhm.
Item 6, we don't have a resolution prepared yet. Do you have any updates you want to share?
It's just not ready yet. I think there still needs to be some more discussions on it, between the Parkview team and the executive team and just, making sure that everybody's on the same page and, we're all on board with what's going to be presented. So we're just gonna hold off on it for right now. It's really close and it's almost there, but I don't want to, be premature with it either. So I apologize for that not being ready.
How's the background or the documentation coming forward? You have all of that? And
Mhm.
all of your ducks in a row, so to speak, when it comes to just writing the resolution.
Pretty much. Mhm.
Pretty much written.
Yeah,
It's gotta be finalized.
yeah. Yeah, it's been drafted, but yeah, we need to finalize it.
Have you gotten to Mary Ann to look at it, or is she the one that drafted it?
I'm assuming somebody from her office drafted that.
Tori?
Yeah, I would think so.
All right, move right along to that. Item 7, suggested topics for future meetings. Do you have anything?
No, I mean, you're nothing in recruitment, but you're trying your best. I don't know what to do to help with folks.
Then we'll go to our next meeting date, Thursday, June 15th at 3:30. Any concerns for anybody for that? All right. Take a motion to adjourn.
Move to adjourn.
Second.
All right, all in favor, say aye.
Aye.
Aye. Sure, thank you, everybody.